The middle ear contains the smallest bones in the human body, which are the Malleus, Incus, Stapes. So these are again in the order or in the shape of hammer, anvil and stirrup shaped. You might also get this question, what are the shapes of the ear ossicles? So these are the bony ossicles. They are in continuity with each other. That means they are just touching one another. So when a sound waves come via the external ear and they just hinge upon this eardrum, what happens? The vibrations start, and from the malleus the vibration gets transmitted to the incus and then to the stapes, and from the stapes via this oval window it moves on to the inner ear. Coming to the external ear, the outer 1/3 is made up of cartilage and the inner 2/3 is bony. So what can happen here is like there is a proliferation of the squamous cells or the skin cells into the bony epithelium, and this results in a condition called as cholesteatoma. Cholesteatoma is a misnomer because it is derived from the word cholesterol and oma meaning tumor. But cholesteatoma actually refers to the migration or proliferation of the skin cells into the bony cells. So what happens here is within the middle ear cavity, just posterior to the middle ear cavity is an important structure called as the mastoid. Mastoid plays an important role especially with the ear disorders. Whenever there is inflammation or infection of the mastoid sinus, even that has the air cells, we call that as mastoiditis. So mastoiditis is a common problem that a patient presents with. There are cases where they have a chronic mastoiditis and the only option would be a surgery. The importance of mastoid with the middle ear is that the middle ear cavity is just in communication with the mastoid cavity or the mastoid sinus. So any infection that takes place in the middle ear easily spreads to the mastoid or vice versa.